Welcome to the Neuroveda Podcast for Complex Health. We feature expert guests who dive into ancient and cutting-edge understandings of health and disease. These conversations are about food, lifestyle, and medicine just as much as about nature, culture, and politics. I'm Gillian Ehrlich, family nurse practitioner, certified in Ayurveda and functional medicine, and coming to you from our clinic, Neuroveda Health, in Seattle, Washington. And I am thrilled to be here with one of our own today. Dr. Carley Squires is a board-certified naturopathic doctor who received her naturopathic doctorate and Masters of Science in Chinese Medicine and Acupuncture from Bastyr University. She also holds certifications from the American Academy of Regenerative Medicine, the American Osteopathic Association of Prolotherapy and Regenerative Medicine, PureRx Cell, a regenerative medicine biotech company specializing in advancements of autologous stem cells and platelet-rich plasma, and advanced training in musculoskeletal ultrasound. She's been a part of Neuroveda Health and before that Center for Healing Neurology since 2016 or 2017. And she runs our regenerative medicine program here at the clinic. And I'm so excited to talk with you today on our 100th podcast. Boom, boom, boom. So it's a great honor to have you at the clinic, Dr. Squires, and to have you with us today. Thanks so much for joining us.
Thanks so much for having me.
So we're talking about plasmapheresis today. And we are really one of the most experienced clinics in Seattle with outpatient kind of purchase on your own plasmapheresis, something different than like, say, the blood bank that's doing plasmapheresis, apheresis. But let's start out under this big umbrella of apheresis. Talk to us about what is apheresis, what is plasmapheresis, what are all these different technologies?
Yeah, so apheresis really just means the removal of something. So there's different types of apheresis. You know, at our clinic, we're doing plasmapheresis, which means we're removing plasma from the blood. And what we're really doing is called therapeutic plasma exchange because we're exchanging that plasma with albumin, which we can talk about later. There's other types of apheresis, like we said, where you can remove red blood cells, you can remove white blood cells, you can remove platelets. You can remove lipids. So all these different apheresis, but essentially that umbrella term just means that we're removing something from the blood. Sometimes we're replacing it, sometimes we're not. Here at Neuroveda, we're of course replacing that plasma, which we're removing that because that's where a lot of these disease-causing substances are hanging out in our blood. So we can remove that and we can put something like albumin or some kind of replacement in.
Got it. Got it. And what are the different key types of apheresis? Because there's a bunch of them.
Yeah, so there's red blood cell exchange, there's leukapheresis, which is white blood cells, there's platelet apheresis, platelets, there's lipid apheresis, which you're removing lipids or LDLs, which people do for when they have genetic markers of really elevated cholesterol, usually like lipoprotein A.
Mm-hmm. Okay, fascinating. And so, and how long has apheresis been around? Because this is like so fun to talk about.
Right, it is fun. So yeah, apheresis has been around for decades. Really, it was like, the machine down in the basement of the hospital that they'd like roll up, for autoimmune crises. So it originally was and still is used in hospital settings for autoimmune issues because it has studies for decades showing the removal of immunoglobulins, which are antibodies. So in autoimmune, when you're creating all these autoantibodies to yourself, but these antibodies, it would remove them from the blood and try to help when the body was just totally breaking down. And then once long COVID started to come about, after COVID, we started to have patients that were going to Europe trying to get apheresis. They were getting something called H.E.L.P apheresis, which is a heparin-induced LDL apheresis. And then they were also getting therapeutic plasma exchange. And so H.E.L.P apheresis is not allowed here in the US. Does make some sense for long COVID as far as the microclotting and things, but the therapeutic plasma exchange, our patients were getting good results with that. And so we thought, well, why don't we offer this outpatient? This is something we can do in the US, and it's a very safe procedure, which we can talk about as well, to be offered in outpatient settings. And so we started doing it about 3 years ago in our clinic, starting off with a lot of long COVID, because that's kind of why we brought it here. But over the last 3 years here in the US, there's been a big explosion of apheresis, plasmapheresis for longevity. We're seeing studies, though, also for neurodegenerative diseases like Alzheimer's, some Parkinson's. So there's a lot of reasons why you would use it, because it's really working on removing a lot of those pro-inflammatory, immune dysregulating substances in your blood. And so that's why it can be good for like a whole host of illnesses.
Yes, there's the way I kind of typically describe it to patients is it's kind of like if you have a pebble in your shoe. If you have a pebble in your shoe, you got a problem. And if you now walk 10 miles, you've got multiple problems, right? You've got the pebble, but now you have the blister and the limp, and your back hurts and your neck hurts, and now you can't sleep at night. And so when we talk about resolving these conditions, if it's something like a bacteria, we can use an antibiotic essentially to remove that pebble that is like that bacteria. But if it's something like a virus, if it's something like an antibody, those things can be really hard to remove from the body. And so plasmapheresis is something that can remove those pebbles that are essentially causing a lot of these cascade effects downstream. And we see
Yeah,
that
absolutely.
Alzheimer's, all those conditions, those toxins.
Right. I like to, it's really just an amazing immune reset when you can take a lot of those
Yeah.
immune markers that are shifting your body towards pro-inflammatory, and then that can go to more autoimmune. You take that out, and it's this incredible immune reset for you. Also, people are doing it a lot for detox of heavy metals or mycotoxins. That doesn't have as much research behind it, but we do have a lot of anecdotal evidence of removing those substances, and which will allow for the immune system to finally get a little bit back on track when it has just been completely dysregulated by either chronic infections or chronic toxic load.
Yeah, and we have been, can you talk to us a little bit about our capacity to send the plasma that we pull out for testing?
Yeah, so there is a clinic, I believe it is Switzerland, right? Am I remembering that right?
Yeah.
Believe it's in Switzerland. I
Yeah.
use labs. They are doing anapheresis over in Switzerland, which we can talk about as well, the comparison of anapheresis and therapeutic plasma exchange. But we can send your plasma and test that. And they test for a lot of plastics and toxins, heavy metals, solvents, pesticides, things like that. So we can get a good idea of what is hanging out in your body, which can be very educational, because not only are we removing that, but where was your most toxic exposure? And then can we help continue to support those detoxification pathways?
Yeah, and in addition, I would say with the patients that we've seen in clinic, and in addition to seeing the numbers of essentially shit we've pulled out
Mm-hmm.
from metals and plastics, we can also see the clinical picture, so that it does match with the clinical picture. People do feel better.
Yeah, absolutely. We see people, I mean, sometimes people will say after, just one treatment, oh my gosh, I feel so much better already. It's like you do feel this sense of that toxic burden almost being unloaded.
Yeah, yeah, so nice. And so talk to us about some of the other things that are pulled out when we do plasmapheresis.
Yeah, so plasmapheresis, of course, we talked about the immunoglobulins or antibodies, which again is why it was used, and is used for autoimmune. You do get what we see in the studies when we talked about immune regulation. Is that we are getting more of a balance between our adaptive and innate immune responses. And I realized I shifted from your question about the immune regulation. So just to step
Mhm.
back, we are seeing removal of heavy metals, mycotoxins. We're seeing a removal of inflammatory cytokines. The biggest ones we usually test are interleukin 1, interleukin 6, TNF alpha. So all of those inflammatory cytokines and immunoglobulins are being removed. And then when we do that, we can switch back and talk about how then we're correcting the adaptive immune response. If anyone's ever heard of Th1, Th2 balance, Th1's a little bit more goes and fights all our viruses and toxins, and then Th2 is shifts a little bit more to autoimmunity. So we do see this shift back to Th1, which is why it can be so great for these chronic infections. And then we're seeing a shift between more B cells and plasma cells of just getting the body more on board to have an appropriate immune response. We're seeing a shift between the macrophages, so again, the innate immune response. We're seeing increased T regulatory cells and T suppressor cells. So the studies really do show these shifts in the immune cells, which is why I say it's such a great immune reset when we're shifted towards more of that pro-inflammatory back to a more balanced immune activated.
Hmm. Awesome. Awesome. And so talk to us about some of the research also associated with pandas, because that's kind of one area where we're actually having recently legislation in Washington. It's been passed in Oregon where plasmapheresis needs to be insurance covered for pandas. Talk to us about what pandas is and why TPE can be helpful.
Yeah, pandas is that pediatric autoimmune encephalitis that usually gets triggered by a strep infection. There's also PANS, which is other sorts of infections, but pandas is specifically that strep infection. So we're seeing that immune dysregulation for those, a lot of antibodies in that response to those. And they have done studies that have showed that TPE is as effective as IVIG for pandas. And we, do get IVIG approved sometimes for pandas, not as much as we'd like. Again, that legislation going on. So both TPE and IVIG could be this amazing treatment for pandas. We've had pandas patients come in. Again, there is an autoimmune nature to that because of the chronic infection piece of the strep. And so you're removing a lot of immunoglobulins and again, doing the immune reset.
And can you talk to us about what IVIG is? And if we're talking so much about removing immunoglobulins, why would you want IV-induced immunoglobulins?
Yeah, so we're removing these immune globulins that are more autoimmune, right? So they're attacking your own tissue. So we don't want those. We want to get those out. And then if you do give immunoglobulins, the intravenous immunoglobulins is IVIG. That's what it stands for. So we're giving these immunoglobulins, but those are immunoglobulins similar to how we said the studies will increase plasma, and, our B cells, our antibodies, but they're producing an immune response that is helping your immune system, not attacking it. So you're taking out these autoantibodies and then replacing them with more healthy immune cells.
Got it. Amazing. And we've just been starting to hear more a little because there's IVIG and then there's sub-Q IG, so it can actually go like into your belly. So it doesn't need to be an IV. It gives you more control over it. And then lately we've been looking into intranasal IG. So that's kind of coming down the pike, and which makes it easier um, for even younger patients. You know, you wouldn't want to be doing an 8-hour IV treatment with a 4-year-old. I mean, sometimes you have to in the hospital for myasthenia gravis or idiopathic thrombocytopenia purpura, some of those deep autoimmune crises. But again, you're not going to be able to do that for currently, but for something like intranasal IG, you can. So,
Yeah, I think the intranasal IG is really exciting, especially for a pediatric population that, yeah, these IVs cannot, sometimes just aren't as easy. So I think that that's fantastic. And some combination of plasmapheresis and immunoglobulin therapy is a really great combination. And we are doing that here at our clinic. People are getting the plasma exchange and doing more low dose. So, not the high dose IVIG that you would get if you were routinely getting it, but you can do 5 to 10 grams, sometimes even 2 grams after to just give a little boost of these healthy immunoglobulins after you pull out the more ones that are causing immune dysregulation for your body.
and I don't know if all clinics are offering that. So I think that there are some um, TPE clinics out there that are, we're seeing like this huge bloom of TPE outpatient clinics, especially for the longevity pieces, the long COVID. But I don't know how common it is to have IVIG offered after, but that's certainly something we can do here, right?
That's absolutely something we can do. We also offer electrolytes afterwards, as well for any depletion of electrolytes. We can also do different IVs. We have an all IV clinic here, so we'll do mitochondrial support, our different immune support after. So we really replete a lot of those, any nutrients, our electrolytes afterwards, which can be a nice treatment. Also, we can do stem cell therapy. So you could put stem cells in after either your own our allogeneic cells. And so that's a kind of a nice therapy too, is after you kind of clean the slate, getting all that toxic burden out. I always tell patients it's almost like then the highways open, and then you could do these stem cell therapies that then can home to areas that need to be most treated, because stem cells do home to areas of most inflammation. So if you clean out all that gunk of the highway and it's just this open path, then it can really go to the areas it needs to be treated. So it's really in a nice combination too, to either replace the immunoglobulins or your own stem cells after the treatment.
That's amazing. And talk to us a little bit about kind of the stem cell process and kind of options or exosomes at our clinic.
Yeah, so we offer autologous, which means from your own body. So we can do a mini liposuction and process those. We also have the ability to bank them now in the US, which is an incredible resource that we have. So you can get, them stored from the bank and infuse them anytime or inject them. We also can offer some allogeneic from umbilical cord tissue. There's different reasons you would do that. Oftentimes that's a lot of exosomes, which are also these cell signalers. So a lot of them can be immune regulation, orthopedics. There's a whole host of reasons you can use these different cells. So that's a big part of our clinic too, is this regenerative medicine aspect alongside all of the chronic illness that we see.
Great, great. So, and we can really let's talk a little bit about, let's see. Okay, so let's shift gears a little bit and talk about the process. Does that sound good? And then we'll kind of finish with how we use TPE at our clinic and what it's, all the different therapies that we can put with it. Uh,
Yeah, so TP, you would start at our clinic. We always do a TP intake just to make sure, is this indicated for you? Get a good past medical history. At our clinic, we're very much more medically focused. Even though we see a lot of longevity patients, we also want to make sure that this is treated as a medical procedure. So we do an extensive lab panel and make sure that you are healthy to get TPE. And then we'll talk about the process of it. For as invasive as it sounds, you're hooked up to this machine and you have two IVs going. One is pulling blood out, going through the machine, taking out, in our clinic, taking out that plasma, replacing it with albumin and going back in. But for, like I said, as invasive as that sounds, it's incredibly safe outpatient procedure, very well tolerated. There's safety studies that, have shown 15,000 patients and 6% had any kind of adverse reaction, and that could be mild to just numbness and tingling, which is usually depletion of calcium from our anticoagulant that is easy to just load up on calcium before slowing the drip, so not life threatening at all. Some people get very severe, like less than 1% might get some nausea or vomiting. We've never actually had anyone have that. So for the most part, again, just incredibly safe. Our nurses are with you through the whole procedure. Every 15 minutes we're taking your vitals. Another side effects could be that your blood pressure might start dropping a little bit just from the fluid dynamics that are going on, but easily fixed by slowing it, giving extra fluids. The only thing you're being exposed to during therapeutic plasma exchange is normal saline, the anticoagulant we talked about, and the albumin. And we can talk about that albumin in a minute. Some people have concerns about that. And so you're sitting there, for about 2 to 4 hours. It depends how much your vessels can handle the pressures of it. Sometimes they like to vasospasm or things, but we have lots of tricks and things to keep those open and everything going. So for the most part, you're kind of just sitting and connected to this machine for 2 to 4 hours. And it's a pleasant experience and you're not really having too many side effects. But if anything does happen, sometimes people will vasovago, like with the lower blood pressure things, again, just giving them fluids and slowing the drip, but really well tolerated.
Very well tolerated. And how many treatments would you do?
Yeah, so that depends on what you're coming in for. So most of the studies for autoimmunity have been 6 total treatments, so 2 a week for 3 weeks. It's kind of the standard treatment for autoimmune. People have done that for long COVID as well, or really a lot of toxic burden. A lot of longevity studies do 2. Our detox will do 2. The reason you like to do 2, so when you're sitting there, we're usually doing what's called like one plasma exchange, and that's about 63% of your total blood. And again, as you're sitting in the chair and getting it pulled out in, only about 1 cup of your blood is in the machine at one time. So again, not very invasive as far as that goes. But over the course of 2 to 4 hours, we get about 63% of your blood volume replaced. If
Mhm.
you were to do that a couple days later, you'd get a different 63%. So there is some overlap, but some different. And also, a lot of those toxins will pull down the gradient from your tissue into the blood. So
Right.
that second round, you can get even more because it's been pulled out of the tissues. And that's why you would do repeated treatments. For Alzheimer's, they do a whole host of the 6 in a row to monthly, every once a month for 12 months. Different studies have done different things. So it would really be, we could really individualize it for what's going on with you.
Hmm. Hmm. And how do people feel afterwards? What's the range of how people feel after a session, after treatment?
Generally, I would say the biggest thing is you do feel fatigued. It's a lot on the system, to pull out 63% of your blood and have that replaced over that course of time. So most of the time you just feel pretty tired. Though, like we said, a lot of times people with really heavy toxic burden, the people that come in and say like, oh, my blood is thick, like long COVID or would have a lot of heavy metals, the plasmapheresis does take out a lot of the clotting factors too, which again can be robust in immune dysregulation. So a lot of times people will feel lighter, better afterwards. But I would say fatigue is usually the biggest side effect that people, a lot of people will say like, oh, I had the best sleep of my life that night, and they wake up refreshed the next day. And so that fatigue's not a long-term thing, but it can be a big procedure as far as just toll on the body, but
Mhm.
recovery is fast.
Yeah. And then are we doing labs in between sessions?
Yeah, so like I said at the beginning, we do a lot more labs, more checking for any clotting variants that could lead to easy bleeding because we are removing those clotting factors. They rebound within 24 to 48 hours usually. Some people are a little slower to rebound. So what we do in between is we do continue to check your blood counts just to make sure we're not causing any anemia, or your blood counts are also important for the machine to know how much blood to remove. So we're getting those done before each one to be very accurate for the machine. And then we also check fibrinogen, which is a clotting factor, just a good one to check. So if your fibrinogen is not rebounding well, we just need to wait a little bit longer. Again, we're just trying to be safe to not increase any risk of bleed.
And if do for a lot of longevity folks, these might be people who are like already marathoners and who are just trying to kind of stay healthy. How safe is, and I know you talked about the safety profile, but how safe or comfortable is it for folks who are really sick or who are concerned?
Yeah, that's a great question. I would say we see a lot of really sick patients just in our clinic in general, that we treat a lot of chronic complex patients, and it's very well tolerated. So I could understand the concern of it being too depleting. You might go from doing it twice in 1 week to saying, okay, wait, we need to give your body a little more time to recover in between. So we're going to do it once a week. So we've spaced out the amount we do. But in my experience over the last 3 years of treating a lot of chronic complex patients, it is well tolerated, even for those depleted patients.
Mm-hmm. Mm-hmm. It's funny, you keep saying the 3 years, but I'm thinking about it, and it's really been, I think, more than that.
Oh, has it? Maybe it has been. Um, Trying to think when we brought TPE into our clinic, and
21, 22. So
yeah,
it was since then. Because it's 2026. I keep forgetting it's also 2026.
right. So maybe 4 years now. That we've been doing.
Um, and so, yep, and the reason I wanted to kind of call that out a little bit more about the status of the patient is that with some of the other TPE clinics that are coming up, some of the concerns that I've heard is that they don't know how to treat folks who are not like perfectly healthy. So I just want anybody listening to just keep that in mind and just be aware, because if you are listening to this in a different city and you're ending up at a different TPE clinic, I just like a longevity TPE clinic, I just want folks to be aware of that.
Absolutely. We see a lot of mast cell activation disorders, for instance, as part of that a common or chronic complex patient that we see. And so being able to know how to treat that pre and post TPE, as far as if there is any mast cell flares or anything like that. We do that's kind of what we treat here, right? So we really are well versed in making sure, you're prepared and what to do after if there is any kind of reaction. Though I will say, as far as mast cells, we haven't seen it trigger a mast cell response in rarely anyone. And I would say you might have a better percentage that I would say almost all our patients that are coming not for longevity probably have some level of mast cell activation disorders. So I would say, as far as, that's why I wanted to comment on what you're actually being exposed to. You're being exposed to that normal saline, that anticoagulant, other than, can deplete some calcium, but does not trigger mast cells. And then the albumin. And so we could go into just talking about that albumin real quick, because a lot of people do have concerns. The albumin, the biggest concern, of course, like with long COVID patients, is, well, our SARS-CoV, is attached to albumin in our body. But they have done studies in vitro of albumin, and there has been, no, it doesn't carry a viral load. And the albumin, though it is from donor plasma, by the time it gets to you, it is pasteurized and sterilized. And by the time it gets to you, it's not even considered a blood product. It is just a protein. And that protein, again, has been studied and does not carry any kind of viral load. And we've never had any exacerbation with that or increased spike proteins or anything like that. And so I would say I don't have any concerns at this point in everything I've read and seen over the years of using albumin, of any concerns at all. I really just view it as this sterilized protein product that we're using for people that, again, we haven't seen any immune reaction to.
And it's interesting because some of the studies actually have shown that even without plasmapheresis, if you actually just give albumin IV, then we change the immune profile. So I think that there is some direct benefit to the albumin going in, even beyond what we're pulling out.
Yeah, and those were the studies done with Alzheimer's too, have shown that, because a lot of those proteins that, like the proteins in Alzheimer's, I'm blanking on it right now.
Oh, the amyloid and the tau.
Yes, thank you. The amyloid, those are attached in our plasma to the albumin. And so if you replace albumin, you're replacing your own, similar to how we're replacing the immunoglobulins with the IVIG and taking those other immunoglobulins out. You're taking out these proteins that are attached to your own albumin, replacing that with albumin. And there's therapy in just the albumin replacement.
Yeah, absolutely. Absolutely. Um, and I would also just briefly mention that the way it's really interesting, the way that the technology has developed, because we use centrifugal or centripetal. Essentially, we spin blood. And so all the way that plasmapheresis works is that we spin your blood and all of the heaviest things move to the outside. And then we essentially siphon out that outside product. That's how we remove things. And that's what became cleared by the FDA in the US, but in other places like Europe and Japan, in-use pheresis is what really kind of flourished, and that's membrane, similar to dialysis. It's a membrane technology, so they don't use albumin replacement. It's not clear. We don't have head-to-head studies about how much, we can't really do it in one person. We can't remove at the same time through in-use pheresis and through plasmapheresis to see how to compare what they remove. Um, but I would say that that in-use pheresis technology is looking at being approved. There is a group working on it that we've been in close connection with. And so as in-use pheresis does become available in the US, we are slated to receive machines. So it's not clear when that'll be, but in the next couple of years for sure. There are some folks who have asked, like, should we just wait for it? And I would not say to wait for it just because of that pebble in the shoe analogy. How long do you wait with a pebble in your shoe while you're walking? Our lives are continuing on. So we do recommend folks, if you are appropriate for plasmapheresis and if you're able to do it now, do it through the current machines that we have. Um, and then we'll see how that happens. And hopefully that does get FDA approval and we can get in-use pheresis in our clinic as well.
Yeah, I think there's reasons for both of them, absolutely. So I think, our goal is to have both of them to offer to patients so we can, kind of assess them and see maybe which therapy would be the best for them.
Yeah. Yep, absolutely. That's very true too. Just like there's lots of different types of apheresis, whether you're pulling out, if you're doing leukapheresis, or if you're pulling out white blood cells for a leukemia, or red blood cells, there's lots of things to do. Some questions I've had are people have asked about fresh frozen plasma replacement instead of albumin. Do you want to comment on that?
Yeah, sometimes in hospital settings, they will use plasma. And the reason you'd use plasma is because it doesn't deplete the clotting factors, those coagulation factors. So when you're doing, sometimes you might do more than 2 in a week if someone is really in an autoimmune crisis. So they might be doing it daily for some people in the hospital. And of course, the risk would be that you would deplete too many clotting factors. They wouldn't rebound like we were talking about in our outpatient setting. So you could use plasma as when you're doing more frequently with the coagulation factors, not depleting them. The disadvantage of that, of course, is you have to think about more infectious disease being transferred, like any blood transfusion. You'd also have to think about the ABO compatible, like your blood type compatibility. So most plasma is usually only offered, to my knowledge, in hospitals. I don't know any outpatient that is using that. Albumin is just a much safer uh, substance to use and does have its own benefits. And because we aren't needing to do it daily for people, that advantage of having the coagulation factors just is gone. So the disadvantages definitely outweigh the pros. And so albumin is a much safer therapy to use, replacement to use.
Excellent. Great. Great. Um, all right, so let's talk a little bit more about some of kind of the unique ways that TPE gets used at our clinic. Do you want to kind of kick that off? And I know we've talked about my background with the Ayurveda, and I can kind of jump in.
Yeah, I think I would love to have you, yeah, express, TPE is an amazing, detox really at the end of the day too. It's this immune reset, but what are we doing? We're detoxing too. And so I'd love for you to jump in and tell us how that melds so well with Ayurvedic medicine. And yeah, to my knowledge, the only clinic that can combine more Ayurvedic medicine and more of these Eastern and Western therapies.
Yeah, yeah, I'm happy to talk about that. And I think, the crux of the question is like, is plasmapheresis curative? Are we curing you? And the real answer is that we are not. We are doing this immune reset. It is a shift, but it's not necessarily a cure. Like, stitching up a wound can kind of like cure a wound. Your body still has to kind of finish it and do it. And so plasmapheresis is best used. Our perspective is that plasmapheresis can best be used in light of a larger program. And we have a real variety of how we do that. So that might mean that there's those foundations of health like diet, exercise, movement, stress management, relationships, environment, how we manage that. So I feel like we're really well positioned to offer those naturopathic and functional medicine and Ayurvedic approaches to cultivating foundations of health that are helpful and supportive. We can implement the plasmapheresis, and then we also can do the regenerative components that you discussed earlier, like exosomes, stem cells. We can do joint treatments because chronic pain is going to continue to ripple into immune dysfunction. We know that. I mean, there's more and more research about our psychoneuroimmunology, the relationships between our mind, our immune system, our nervous system, our GI tract, and our endocrine system. All of these, despite being presented as silos in Western medicine for the last 150 years, and really it's not much more than 150 years since this kind of reductionist approach to health and medicine. For millennia before that, we've always been one person. And in fact, we just did a podcast um, on Ayurveda, and she was saying that, there's not really like mental health conditions that are really talked about in Ayurveda because the mind is never really separate from the body. So it's delineated in different ways, basically by the characteristics of whatever the mental health issue is, but also looking at the physical ramifications of that. And so in our clinic, we're also going to talk about those foundations. And then we're going to talk about how do we position plasmapheresis in the middle of a larger program. So that might be detox, that might be immune reset, that might be for pain, that might be for cognition, that might be for physical structure. We have a lot of hypermobility patients. And so this is where the Ayurveda can really come in, because Ayurveda has actually been using detox for millennia as well. There's a process called panchakarma. Pancha means five, karma is actions of detox. And so it is a whole procedure, which is really about 3 weeks long. It's not as, it's intense in ways that I can't even describe, but if you follow our material, we've had one of our, actually Shannon Starkweather, our director of operations, has recently gone through a panchakarma and has been posting what her experience has been, and that it was intense in ways she did not anticipate, which I find is often the case. And so what that means is you're oleating internally. So you're drinking either ghee or other types of oils in order to oleate. Now we think, like that sounds disgusting, and it in some ways is. You can modulate it with things like salt or lime, to make it a little bit more palatable. But the idea is similar to all of the liposomal therapies that we see now in Western medicine. Liposomal therapies or hydrophobic, essentially fats. We use fats as vehicles because all of our membranes are fats. And so when we attach a functional molecule to a fat, it actually can drive deeper into the system. That's the idea behind liposomal vitamin C or liposomal glutathione. And so using those fats internally, drinking them essentially is allowing some of those toxins to essentially slide out of the deeper tissues and back into circulation. And then panchakarma includes oleating the body externally. So that is oil massage, that's oil in the nose, which is called nasya, one of those panchakarmas. That's oil in the ears, oil on the forehead and over the scalp in a procedure called Shirodhara, which we offer in clinic. And so we use this oleation externally along with long strokes on the body that are for lymph drainage or moving lymph. So we essentially use these liposomal therapies. Then we use manual manipulation. We work to make folks feel really safe and kind of cocooned in like a womb with panchakarma. So your mind is really safe. You feel really safe. So you can really open up the detox channels of your body. And then when everything is flush into circulation, Ayurveda will use therapeutics like enema, like castor oil for purgation, to essentially eliminate. That's what's been done the last 10,000 years. One of those therapies is actually called Rakta Moksha, Rakta meaning blood, Moksha meaning liberation. So blood liberation, obviously 10,000 years ago was done typically with leeches. Even current day in India can be used with leeches. But we get to use plasmapheresis. And so plasmapheresis fits right into that Ayurvedic paradigm. And what we use in our clinic, the way that we position our plasmapheresis is in the midst of these larger programs. You don't have to do it that way. Folks do say, I'm doing all my own work. I just want to come and get this shit pulled out of my system, and that is fine. Or people have an option of really doing this deep therapeutic, kind of provoked detoxification procedure with plasmapheresis and with these, this east-west bridge, this east-west medicine.
Mm-hmm.
So lots of options.
Yeah, I always tell people the analogy of, if you're pushing a boulder up a hill and how hard that is, and just it's hard to get traction. So a lot of people have come to us that have tried, for instance, with long COVID, that have tried every therapy possible and are still really struggling. And so what I tell them is, yeah, it's not necessarily this miraculous cure and the only thing that you'll ever need to do. But what I think TPE does, the therapeutic plasma exchange, is takes the hill out. So you still have that boulder to push, but you don't have the hill anymore, and you can get more traction with other therapies too. So it really is great as an additional, not a one and done, but an additional to treatments with everything else that like you've talked about that we're offering at our clinic. Those can all be adjunctive care. And people usually other treatments start to get more efficacious after TPE because, again, you're removing the hill and you can move that boulder so much easily on flat ground.
Absolutely. Absolutely. And so some folks will come to our clinic for, they have long COVID. They were fine, happy, living their life, working their job, doing all their stuff, playing pickleball, got long COVID, now might either be bedbound or just not feel as well or not feel as much capacity. And we need TPE, plasmapheresis, or this larger program to kind of make that singular shift. And then the hope is that they then go on their way and they never need it again. The
Mhm.
alternative is folks who are interested in longevity, who might be wanting to pull all that shit out of their system, and then and then they might do that once and then never need it again. Or, what Ayurveda really recommends, like in the way of a panchakarma, is like a periodic detox. So often at the change of every season, it's recommended. And so that might be something that folks come in for two, for longevity. We will often do two plasmapheresis sessions as opposed to the full six. And so maybe people come 4 times a year or for two sessions, or they do six once a year, but doing some sort of rhythm with these things so that we kind of can age well, right? So we talk to patients, our
Right.
goal for patients is really that I help you to be able to drop dead at 100 at the way, place, and time of your choosing. Um,
Right.
and so we really
Yeah,
want,
that's a good point. We didn't talk about that. We talked about like more of the acute timing of it, but I didn't mention, yeah, there usually is a maintenance. Some people though do just get that immune reset. They're on their way. That's all they need to do. But when we're talking about longevity or the Alzheimer's or autoimmune, of course, it isn't doesn't take away your memory cells, for instance. So you are going to recreate those. So again, it really there sometimes is a maintenance for a lot of these conditions. Like you said, some people will do it quarterly or yearly, depending on what else they're doing, how they're feeling, what else is in their regimen.
yeah, yeah. And ultimately, plasmapheresis, the goal is happiness, right? The goal is that our body feels better, we feel lighter, and we have more capacity for living the life that we want to live.
Right. Yeah. That's, I think, yeah, our goal of what we're trying to do with people at Neuroveda, right?
Yes, yeah, absolutely. So what else? Anything else that we should mention about plasmapheresis?
I want to say we almost covered everything. Was there anything that you had questions about that I didn't talk about, the procedure or anything like that, that you wanted to make sure we cover for patients?
Um, I think we've pretty much covered it. I mean, we've talked about the history that it's been in use since the late 60s. So for the last 50 plus years, plasmapheresis has been used commonly. It really got going in like the teens and the 20s in
Mhm.
terms of figuring out about it. And I think the first human plasmapheresis was in the 50s, but it's been in really common use. And like in the hospitals, they'll do it with babies, with infants. I mean, obviously, we don't do that here. We don't typically do, pediatrics are always a case by case basis. We've talked about some of the conditions that it's used for, the autoimmune, the pandas, the Alzheimer's, the Parkinson's, um, the um, the long COVID, the fatigue, the toxicity, the longevity, the mental clarity. We've talked about that it's not curative, it's part of these larger programs. The research is better and better every year for how much immune reset and how much immunomodulatory
Yeah,
work.
maybe what we could do, we could link, we do have a lot of those studies on our website. We could also link them here in the notes for people. Again, yeah, we need more and more studies. The studies on a lot of these things outside of autoimmunity are newer, and we definitely need more as always, but they are coming out and they are being done more and more.
Yep, absolutely. Absolutely. Um, and we've talked about the process and how it is at the clinic. So if folks are curious for more information, there's a lot on the website, like we just talked about. And then the first step is really scheduling an intake with you, an hour-long intake with you to make sure that folks are medically appropriate. Even if we've had some questions, sometimes people are like, even if I know that I want this, do I really need to have the consult? But the consult is always necessary so that we can make sure that you're medically appropriate and we can get you prepared for which labs and how to be ready for it.
Yeah,
So,
there's a lot of logistics that go into the labs and the timing and what to expect. So I think that appointment is great. People always learn a lot, and then you just come in knowing what to expect. So
yep, yep, absolutely. And I just want to reiterate that we're so lucky to have you, Dr. Squires, in our clinic because you do such a great job taking care of folks and really seeing the whole person, even through what can be seen as like a technical procedure. But you're just such a great resource for folks about how to integrate their TPE into larger programs and into making sure folks stay safe and are comfortable through this whole process. So thank you.
yeah, you're welcome.
And we love that you've joined us today to discuss how to make our whole world medicine. We rise or fall together and are committed to sharing knowledge and insight that empower us and our communities towards greater health. Thank you for listening to the Neuroveda Podcast for Complex Health, and we'll see you next time.